I'm often asked by my patients, "Doctor, why are you getting so many investigations done in pregnancy? I've only just gotten pregnant." Honestly speaking, if you've not had a preconception counseling done, that means you've not had certain tests done before you got pregnant, it is possible that you have certain problems, which if uncorrected during pregnancy can both cause you problems as well as cause problems to your unborn child. Thus, we need to get certain tests done to understand and correct these problems as soon as possible. This is also important because in the first 3 months of pregnancy is when the baby is being formed, and we don't want any of these problems to affect the unborn child. So what are the 10 essential investigations that we should get done in the first 3 months of pregnancy? Check your hemoglobin. If your hemoglobin is low, then you could be feeling weak all the time, as well as the fact that your unborn child may not develop in the proper manner. Check your blood group. If you have a negative blood group, that is Rh negative, then we need to check the blood group of your husband as well, because there could be some complications otherwise. Check for thalassemia status. Thalassemia is the most common genetic disorder in our country. And if you do have thalassemia minor, and honestly, there are sometimes no symptoms even if you do have thalassemia minor, then we do need to check for your husband's status as well, because it can sometimes be very dangerous for your unborn child. Check for sugars. I know you would say that most women who get pregnant are very young, but yet polycystic ovaries being very common in our country, and such women can have elevated blood sugars in the beginning of pregnancy, and if the sugars are elevated in the first 3 months, it can lead to either miscarriages or certain very bad defects in the unborn child. Check for the thyroid status. Again, in our country, especially in certain parts of the country like Bengal, thyroid problems are absolutely endemic. And if the woman has a thyroid problem, it is possible that the child undergoes a miscarriage, or the child's brain development may not be up to the mark. And as I said, we wouldn't even get to know before maybe 5, 6 or 7 years after the child is born. Estimate the vitamin D levels. Funny as it may seem, we've always thought that vitamin D levels are important only for bones. But more and more reports are saying that vitamin D levels are very important in pregnancy, not only for the mother as well as for the child. A vitamin D deficiency can cause increased risk of gestational diabetes, increased blood pressure, as well as increase the chances of convulsions in the newborn child. Check for rubella status. Rubella is a virus against which you would have been immunized when you were born by being given an MMR vaccine. But sometimes is missed, or you have not achieved adequate immunization against the virus. And unfortunately, if you contract the virus during pregnancy, the unborn child can again have certain defects. Getting a urine routine and culture done, simple as it may seem, sometimes what you have is an asymptomatic bacteriuria, meaning you have an infection, but you don't have any symptoms of it. But unfortunately, because of the infection, again, you may suffer a miscarriage and not know why it happened. An ultrasound should be done at the 6 weeks of pregnancy. This ultrasound would give us a lot of benefits about knowing that the child is healthy and safe, and also that the pregnancy has occurred at the right place, that is inside the uterine cavity. Last but not the least, doing an ultrasound between 12 to 13 weeks of pregnancy for what we call a first trimester screening to rule out Down syndrome. I would be discussing this in a later video of mine. Thus, as I said, please speak to your obstetrician or the doctor who's looking after your pregnancy and request for all these tests in the first 3 months of pregnancy to ensure that you have a healthy and safe pregnancy.